Welcome to Medcast. Here we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. My name is Dr. Wafaa Faysal. I am a consultant pediatrician in Dubai, and my guest for today is Dr. Hassan Galadari. Dr. Hassan Galadari is an American board-certified consultant dermatologist at Galadari Derma Clinic in Dubai, and he is an authority in the field of dermatology. His contributions to improving skin health and skin appearance are very well recognized. Dr. Hassan, it's an honor to have you with us today.
The pleasure and honor is all mine, Dr. Wafaa.
I've been waiting for this episode for so long.
Okay.
And finally it's happening because I think it's going to be a very interesting episode and mind-blowing, especially when it comes to skin health and skin appearance. Okay. Because as we know that skin is the mirror of our health.
It is.
Yes, it is the largest organ of our body, and it is a dynamic organ, and it is, I think, directly related to our health. Mm-hmm. So when it comes to skin health, there is a lot there. So from the basics, I think that everyone should be aware about at the moment, like that healthy lifestyle, including good sleep and exercise, healthy diet, in addition to the skincare routines, the sunscreen, are basics for improving skin health.
Yeah, everybody knows this now.
Everybody knows this. So as much as these things are very important and they are the basics, but in this podcast, I'm not going to speak about these things because they are already well known to probably most of our audience. So we'll go directly into the part that many people are waiting to know about and probably they hear a lot of things and they are confused. They don't know what to do in order to improve their skin health and skin appearance.
Okay.
So the procedures for improving skin health and skin appearance, we hear a lot about lasers, we hear about microneedling, radio frequency, peeling. So we'll start with laser or whatever you decide.
All right.
So I leave it for you to
I'll tell you what. Let's put them in a certain way. So for you, basically, to kind of know how the division is, and then you can tell me which one you want to start off with.
Okay.
So these cosmetic procedures usually supplement or augment our skincare routine, because skincare routine is the basics, as you mentioned, and it's something that we do on a regular daily basis. But then, you require certain procedures that will help, enhance your skincare routine and your skin health. And these can be divided into either injectables, things that are injected into the skin. They can also be divided into energy-based devices. And these are, for example, lasers or, energy-based, machines that we tend to utilize that will tend to enhance the collagen production and so forth. So this is, that's on that other level. And then you have also chemical instigators, and these are your chemical peels, say, for example, or things that you apply on the skin, whether you do it at home, whether you do it in your clinic, that are considered professional grade, that will also enhance the skin's health. And then finally, and there's this new thing that people are talking about, is basically supplementation, which I think we will delve about a little bit later on. So this is basically how I would like to, kind of divide it.
Yes.
And now, it's up to you which one you want to start off with first.
Okay. Injectables, I think Botox and fillers are available everywhere now in the world.
Okay.
And do you like to tell us a bit more? What's your insights on this topic?
All right. Okay. All right. So the injectables themselves are also divided into different ways. So you have the injectables that we consider to be neuromodulators, and which will include your botulinum toxin. And your botulinum toxin, the way that or Botox, that's the brand.
Yes.
The way that it works, it really kind of relaxes the muscle. So because if you're relaxing a certain muscle on a certain part of the body, what tends to happen is that the skin is very much attached to the muscle. So the skin on top of that muscle also tends to relax. So if you have dynamic lines or dynamic wrinkles, mainly in the forehead, around the eyes, they also tend to relax. So these are your neuromodulators. Then you have your fillers. Now your fillers are able to fill. They are not like neuromodulators. They don't relax the muscles. You have a defect, you have a little bit of a depression on a part of your face. then your fillers will enhance that. They basically kind of fill up an area. For example, if you have hollowness underneath the eyes, if you have depression in your cheeks, your lines in the nasal fold, you want to enhance your lips, you inject your fillers. And then the fillers are also divided in many different materials that are injected, the most common one being hyaluronic acid. And then the final injectable that we tend to use is that these are your biostimulators. Now, these are not fillers, they are materials that, when injected, enhance your collagen. These will include your calcium hydroxylapatite, also known as Radiesse. They will include your polylactic acid, also known as Sculptra. They will include polycaprolactone, also known as Ilance, and also include other materials such as, everybody is talking about these days is your PDRN or polynucleotides that comes from salmon.
Yes.
Okay, so and then you have also your other mesotherapy cocktails that contain amino acids, vitamins, glutathione, and antioxidants, and so forth. These are also considered to be part of your injectables.
So that's great. How will the patient decide which is the best for him? Of course, he has to visit the dermatologist.
For me, the patient doesn't decide. All right.
Okay.
The patient doesn't come and dictate the procedure for you. The patient comes in, tells you a problem, and then based on that problem, the dermatologist or the expert has to formulate a solution for that problem, because it's not usually just an injectable that will resolve the problem. Sometimes it's a combination. It's a combination of a neuromodulator in addition to a biostimulator, or sometimes even an energy-based device. You have to combine them together. There's no one-stop shop. I can't say, hey, this is one procedure, it's going to work for everything. You have to really kind of combine it, and it has to be catered to each individual. For example, if you come in and see me, it's different than, for example, if somebody else comes in and sees me. Everybody's treatment is catered differently based on their needs.
Yes. I ask you this on purpose because I hear many women, for example, it's for men and women, let's also be
Absolutely.
fair.
Yeah.
Yes,
I've had things done.
Exactly, of course. Men deserve also to look good. And but I hear many women in my work, like as a pediatrician. So I want to do this procedure. They tell me I want to do this procedure. I tell her why this procedure, because she has heard about it from the neighbor, from her friends, from social media. So that's why I asked you this on purpose. So please, the people, men and women, should visit the dermatologist and ask the expert opinion because there are so many procedures and injectables. And not everything is for everyone.
You're absolutely right, because a lot of people follow social media, and there's a lot of trends.
Yes.
So people come in and tell me, "Hey, listen, I've heard about polynucleotides. I've heard about the salmon thing.
Yes.
I want to do it." I look at their face, and their face looks great. I tell them, "You don't need this. I mean, it's not a procedure for you. Maybe it was great for your neighbor because she needed it because her skin is bad, but your skin is fantastic. You don't need that procedure. You need something else." So it's very important to educate the people what these procedures are used for, because everybody goes through these trends. The salmon polynucleotides one are the trend now. I remember a few months ago everybody was talking about polylactic acid, also Sculptra. Everybody wanted Sculptra. I had patients come in as young as 21 years of age. They wanted Sculptra. I'm like, you don't need it. You're still too young for it. So it's very, very, education is very important.
Yes, for this sake, we are here today, and we are honored to have you again. So how do you find the fillers, for example? Because there was in the past a trend to do so much of fillers, and we saw big faces.
Yeah.
So nowadays, it is a bit better.
That's a great question, because I remember when I first started doing fillers. I would say I've been doing it for nearly 20 years now. I mean, I look young, but I'm not.
You look perfect. Really.
So I remember I was extremely conservative because I liked natural beauty. That's how I perceive things. I mean, for me, and if you look at all the different studies that have been published in terms of cultures and ethnicities, and looking at things that pretty much anthropological, and how people are attracted to the other individual, and it's always been the rule of average. If you look average, if you look natural, people are attracted to you. Anything that's exaggerated, then people find you a little bit different, a little bit off, and you're not as attractive as you're supposed to be. So I've always been conservative. That's how I perceived it. And people used to complain. They go like, "We came in and saw you, and you've injected that, but we don't see it." but you're not supposed to see it. That's the whole point. My touches have to be there to enhance you in a way that people are not able to see it. People are able to see that you're relaxed, that you're comfortable, that you're looking great, but it's not that exaggerated. The cheeks are not too big. It's not too, the lips are not too large. That's how I've always managed my patients. And it's funny enough because those same people who used to complain that my work was very natural and very conservative now are coming back again. They want the exact same thing. So I'm glad that the cycle has it has kind of
Yes.
turned around, and people want that whole natural aspect of things, and it's important. And unfortunately, what has happened is that it's given fillers a bad reputation. So people are now talking, I don't want fillers injected. There's nothing wrong with them. I mean, if they're injected in the right way to get the right results, you get beautiful features.
Yes.
So but people will tell you, no, I don't inject me with fillers. So here again, education is extremely important. You have to tell them. I mean, I would need to inject a little bit of filler. You have to trust me because not all fillers are the same. A little bit of filler using a different technique, and then you'll get the results that you will also like. So it's very, very important in
Yes.
that aspect.
Very important what you have mentioned, because really what we want is a little bit of enhancement and improving the appearance,
Yeah.
not to look different. We want to stay
Absolutely.
like the same people, the same person.
So I'm closing into 47, and I want to
God
look
bless.
47.
Yes.
Okay. I want to look like a healthy 47 years
47-year-old
old.
man. Yes.
Yeah. So I mean, I
Yes.
don't want to be 20. If you look at myself in
Exactly.
20, I don't want to be
Yes.
20, Aslan.
Yes.
Okay, but if you look at myself in 20, I mean, it's different. I mean, the way that your maturity is different, the way your thoughts are different, and also the way that your looks are different. So really, I want everybody to, own their age, okay, and look the best for their age.
This is a great advice. So there is a lot of consulting there in your
Oh,
work.
absolutely.
Yes.
A third of it is,
Yes.
is psychiatry,
Yes,
I would
yes.
say.
Why not? Why not? So sometimes, due to the stresses of life and the fast life that we are living at the moment, women want to go to work, want to look good, want to achieve. So
Yeah.
sometimes they just feel, oh, I don't look good out of the stress.
That's true.
And the stress management is also required, but not through injecting unnecessary things when the skin is okay, going to other forms of stress.
Absolutely.
Yes,
No,
relief
I agree
techniques.
because I usually tell patients, and this is what part of my during my consultation, I tell them, why are you doing this? And if they tell me that they're doing it because, they've lost their job for somebody who's younger, or they're going through a divorce or things like that, I tell them, no, this is not something that you need to do. I mean, you need to do this for yourself.
Yes.
You need to do this because it is going to enhance your self-confidence. You'll be more productive, okay? Because whatever it is that you're doing is not going to bring your job back, okay? So you have to do it because it's going to make you feel good.
Yeah, yeah, exactly. So we move now to the other techniques like the
Energy-based devices.
energy-based devices
Okay.
and lasers.
Yeah.
Yes, please tell
Yeah,
us more.
So I gotta say, I mean, lasers are considered to be, we'll say it in the podcast. Lasers considered to be always sexy. I mean, you're coming in, you want to do something, and it's a machine.
yes,
It sits down in the office, and it's always great. I mean, sometimes there are certain machines that sell themselves because they're branded, and the results are really, really very good. But the way that they tend to work, and we can divide basically lasers in that sense, is that based on the energy that they give off. That's why we call them energy-based devices. Now, some lasers, the way that they tend to work, for example, people think about lasers as, they're laser hair removal and so forth. But no, but lasers play a crucial role also in rejuvenation. But the way that lasers work is that, the normal lasers, is that they have a specific part in their skin that they're able to focus on. And, they give off an energy, and that part of the skin absorbs that energy. For example, a laser hair removal, the thing that absorbs the energy is the pigment. And our hairs are pigmented, so they're dark.
Yes.
Once the energy goes through, the hair heats up, the hair dies, and that's why the hair goes away.
Yes.
So that's how it tends to work out. Also, vascular lasers, lasers that are used for patients with port wine stains or angiomas,
Yes.
vascular
Angiomas.
anomalies. Yes.
Yes.
So those lasers, the thing that absorbs the energy is the hemoglobin in the blood vessel. So that heats up and also makes sure that the blood vessels go away. And then, the hemangioma tends to go away because of that. So that's how lasers tend to work. And then you have other lasers, for example, that will work on, for example, like your CO2 lasers will work on the water content that's found on the upper part of the skin. And that's the reason why it gives you more of a rejuvenated effect. So that's where your lasers are. And then you have other energy-based devices, which will include your radiofrequency. Now, radiofrequency is simply heat. All it does is that it's a different wavelength. It's not a laser. It just supplies heat into the skin. Because there is heat and we have collagen in the skin, the collagen starts to denature. The collagen is in a certain structure. It starts to change the structure. Because it's changed the structure, now the body wants to bring it back again. When it does that, it produces more collagen. And it brings it in a certain way that it's better than it previous. And hence the reason why it enhances the person's look. So patients who undergo, for example, radiofrequency tend to kind of look, lifted and so forth. It's because the way that their collagen has restructured back again. Okay, so that's your radiofrequency. Yes. Then you have ultrasound. Ultrasound is another different type of wavelength. It doesn't use heat. It uses wavelengths. That's sound. It is able to penetrate a little bit deeper. So it not only affects the dermis or where the collagen is, but it can also go downwards towards where the fat, and at the same time also affect the fat. And hence the reason why it enhances, skin tightening. Right. At the same time, it also enhances your collagen. So all of these are the different energy-based devices and how they tend to work.
Yes. This is amazing, though. Because, for example, when it comes to laser technology started with research on skin.
Yeah.
And now they are using it to other aspects, like in ophthalmology and other fields.
That's correct.
And they found that it's not only stimulating the collagen, it also prevents skin cancer. And modifies the genes responsible for aging, so it can even affect has a genetic role.
It definitely is, and this is a field of epigenetics in which lasers are able to interplay very, very closely to the actual genetic makeup of the skin.
Exactly. Yeah. So now, as a great expert with me today in dermatology, I will ask you, what is the most favorite procedure out of these three, the ultrasound, the radiofrequency, or the laser, you will choose for a patient or a man or a woman, middle age, like the skin, of course, started to get a bit like aging, but in the early stages.
All right.
And they want some better appearance. What will be your choice as an expert?
So I can. You mentioned middle age.
We know every case is different.
Every case is different, but I think the best person to kind of
to start with,
yes. who's a person.
Myself, for example.
I was going to say myself because you're still young. I'm the middle-aged one. Yeah, because I looked at the definition of middle-aged.
It's a free consultation for me.
So I tell you, usually patients, when it comes to lasers, if you look at lasers themselves, I believe lasers are a little bit more specific. So, for example, if you're coming in, you have issues with pigmentation, you have a laser for that. You have an issue with hair, you have a laser. If you have an issue with vascularity, you have a laser for that. So lasers are very much specific for that area. For when it comes to rejuvenation, I like the other energy-based devices such as the radio frequency or the ultrasound systems. So, a middle-aged person who comes and sees me, basically my go-to technology is probably going to be radio frequency. This is something that I really tend to kind of work most with. And there are the technologies in the past, they would just provide the heat immediately onto the skin. Now, however, there's a much better focused way of supplying the heat or the energy, and this is through microneedling. So what happens to it is that the handpiece itself puts out little small needles. It penetrates the skin, and then the radiofrequency is very much directed into the area that it's supposed to be based on the depth. So it's very much targeted. So you get really great results. Yes. So I would say a person such as who's middle-aged, if they want to start it off with, I would start them off with a microneedling radiofrequency.
Can you mention the name, because we hear out Morpheus and this is microneedling with radiofrequency, not for the sake of marketing or anything, but this is what we hear.
That's correct. So
microneedling with radiofrequency, like Morpheus.
Like Morpheus. The Morpheus 8 is an example of a microneedle radiofrequency machine. And then if we're talking about that, I also since we're not branding anybody, it's not commercial.
Ultrasound
would be like your all therapy. So your all therapy or Althera.
Yes, Althera.
Yeah,
we
that's
hear a
that's
lot
going to be
about
your
no,
ultrasound.
just because these terms are used by the people.
Absolutely.
So we need them to understand what we are referring to.
That is correct.
So the first choice will be for me, let's say, and for you and
Yes,
me, will be
for all.
microneedling with radio frequency, or what people
Yes.
refer to as Morpheus.
Yeah.
And Althera, you keep it for whom?
So you would keep it if a person has a little bit more of a skin laxity, okay, or at the same time they also have a little bit more fat pockets, or it's in addition to the laxity that they have, but they also are a little bit big in certain parts, for example, such as the neck and so forth. Then I need something that's, I don't want to say stronger, but I need something that's kind of will be able to pick up the weight, and it will be probably my ultrasound. So that's the
And the results are amazing.
All right, so
and the three of the techniques, let's say we said the heat energy based,
or the other. So I
Yes.
tell you, none of
Procedures.
at one point in your life, okay, things are going to sag down and you will require surgery. Okay, I am looking for
Facelift, you
a
mean.
facelift,
Yes.
exactly. So I'm looking at one point in my life. I would say when I'm maybe 55, I will probably need surgery.
Maybe more, Dr. Hassan.
We'll
Really,
see.
you look great. I think at 60.
Yeah, but when
Yes,
you see now, especially now, I mean, the neck lifts and so forth are looking really very good. But so these procedures don't
Rush.
Yeah, exactly. They don't kind of take over those procedures. The lasers don't take over that. For example, the surgeries, they just make them a little bit delayed.
They delay them.
Exactly.
Yes.
So
It's important to avoid cutting, skin as much as possible, in my opinion.
Well, I mean, I tell you, I mean, if it's done in a conservative way, and even plastic surgery now is done in a very beautiful conservative way, it works very, very well.
Yes.
So there's no problem with cutting.
Yeah.
But there are certain individuals who are averse to having surgeries. I mean, people say, I don't want to get into the knife at this stage, because any procedure that you do has a shelf life, meaning that even if you do, for example, a facelift now, in your 30s, I'm just going to give you an example.
Yes.
Okay, once you're in your
50s.
50s, you're going to need another one. You're going to need a revision, whether it's a
Exactly.
blepharoplasty, whether it's a facelift or anything of that sort. So you need that. So it's not a permanent solution. So why do that in your early years, in which you are able to kind of compensate with something else,
alternatives. There are alternatives,
and then kind of push the surgery until the last resort. But I'm not saying we're not going to remove the surgery.
No,
the surgery
no.
will be there,
Yes.
but it's going to be at the end.
Yes, and we are grateful also for the advancements in plastic surgery.
Absolutely.
And what they are doing, we have really amazing results. However, delaying the surgery is a good option, especially as you said, we own our age. We are happy to look in this age, but in the best way we can. Let's
Absolutely.
say. So the microneedling with radio frequency is a good choice. Are there any side effects for these three techniques: laser, microneedling, radio frequency, and ultrasound therapy?
Everything that you do will have a side effect. I mean, any medication or any therapies that we actually apply on our patients will have side effects. So if they're not done under, of course, the right conditions and also the right parameters and the right practitioner. So if somebody else was doing them and they use the wrong parameters, for example, of an energy-based device, you can cause burns. This is very, very common. A lot of times, the microneedle radiofrequency has had a very bad reputation in social media because people were basically changing the parameters. They were causing fibrosis to happen. They were causing fat compartments of the face to kind of get deflated. And it's not the laser's fault. Okay, it's not. The machine is a machine. It's the person who is kind of
calibrating
the machine.
Yes.
And it's for example, it's if you're driving a car, the car did not get into an accident. It's the driver who got into the accident. So it's the same thing when it comes to these energy-based devices.
Very true. So again, choose a great dermatologist and someone you trust. Someone who has been in practicing in improving skin health and skin appearance, and has the expertise also in these new advanced technologies, because there are many great dermatologists, but this is not their field of
That's true.
expertise. So we choose someone who is doing these things.
An advice I would like to give is that if you see somebody or a practitioner who's pushing treatments on you, on a patient, then
run away,
exactly.
Run away.
Yeah, I mean, if you have a practitioner who's telling you don't need certain procedures, not this one, you need the other one, then this is the type of person that you want to kind of think about. Exactly. Unfortunately, however, individuals now want things done. So education is extremely important. And this is the reason why we're doing this. I mean, we have to
and
kind
we'll
of
keep
make sure.
doing. Probably we'll have another episode with you because this is just an introduction. Because each
It's
one
true.
of these things we are mentioning really deserves to talk about in details,
Absolutely.
and people deserve to know more about them.
Absolutely.
Now we move, I think, to the skin products
Okay.
and supplements that are directly affecting or improving skin health and skin appearance. So some of them are topical, like we apply them on the skin,
Yes.
and others are oral, so we take them by mouth as tablets. So where do we start?
Okay, so I'll tell you what, the topical, let's do the topical ones, because
Yes.
the topical ones, you're applying something on the skin and you know that it's going to work for you. For example, you know, your vitamin C, your L-ascorbic acid, your resveratrol, your retinol, all of these applications on the skin definitely have an effect there, because the skin in itself is, even though it's a barrier, it's able to absorb certain actives. And, you know, these are the actives that I kind of
Yes.
mentioned. So it definitely would work in that aspect, depending on the concentration, depending on the formulation, because sometimes if it's the molecule is too big, it's not going to get absorbed and so forth. So topicals will tend to work. My recommended or recommendations based is also going to be based on what the patient is going to require and how, you know, how they rejuvenated they want to kind of look. For me, it's always great. I like to keep things simple.
Okay.
Whenever it is, if, for example, you wake up in the morning, you would want to kind of use a cleanser that's catered to you. If you have oily skin, for example, your cleanser should have a little bit of salicylic acid. So salicylic acid in your cleanser will help decrease the oiliness there. So that's where your active plays a role there. In the morning, you would want to apply, for example, your vitamin C, because because you're also going to be applying your sunscreen.
Yes.
And your SPF with your vitamin C, if you put them together, it actually works better. So it has a you know an additive effect, if you want to call it. So that's where I would want to do that. And now also for me, the SPF is the number one anti-aging topical ever, because it really prevents ultraviolet radiation effect on your skin and also prevents wrinkles and burns and so forth, and hopefully skin cancer. That's something I would do in the morning. Come nighttime, that's the time in which you would want to kind of play around on the things that you're able to apply. It's always great to utilize retinol, but retinol at an early stage, and if a person is in their 20s, they don't require retinol. All they need is basically just a simple moisturizer, something that has a little bit of hyaluronic acid, provides you with a little bit of moisture so that it retains the body's or skin's normal function. As a person progresses in their late 20s, early 30s, that's where you would want to introduce your retinol.
Yes, to explain to the audience that the retinol increases the skin turnover.
Exactly.
Instead of 28 days, probably in 10 days or something
Absolutely.
like that.
So think of it as both of you and I, we like to play exercise and so forth, and we go to the gym. So retinol, when you apply your retinol, is as if you're going on a treadmill. Okay, you're not walking, you're going on a treadmill. Yeah, you're running. You're jogging. Okay, I don't want to run. Let's jog.
Jogging, yeah.
So you're jogging. So as you can see, when you're jogging, your heart rate goes up and so forth, and your body starts becoming a little bit tighter. You feel a little healthy. You feel a little younger. You feel more awake. The skin does the exact same thing. That's with your retinol, because it increases the turnover. And the increase in turnover also stimulates or activates certain genes in your skin that will also activate collagen. Okay, so collagen production is also activated with the application of retinol. But then you have also other topicals that can also be utilized. We've mentioned, and it all depends on what the person needs. If they have, acne-prone skin, they can apply their niacinamide because it helps a little bit of their acne.
Vitamin B3.
Vitamin B, exactly.
Yes.
Okay, so they could do that. Then, you have your resveratrol, which is your antioxidant. They can also apply that there
This
too.
is new, resveratrol, or no?
It's
The first time I'm hearing about it now.
No, it's been around for some time.
In some products?
Yes, some of the products. You can apply also your tranexamic acid if they've got pigmentation, so they could do that there too. So it depends on the actual indication. But for a normal person who doesn't have any major issues, the basics are, as we mentioned, vitamin C or antioxidant and vitamins, or such as vitamin C and SPF in the morning, and retinol at one point in the evening.
That's very simple, I think, and clear. So retinols are doing a great job.
They are.
Let's say.
And then
we are grateful for them.
Yes, we are.
They started first of all for acne.
They did.
And look where we are now.
They did.
At a different level.
They
Yes.
did. You know, I mean, we've been using, we've been using isotretinoin, which is,
Yes.
the Roaccutane.
Yes.
People talk about it
Yes.
as the brand
Yes.
name, and it's for me at least, it is a cure for acne. I mean, it
Yeah.
really kind of makes sure that your
Yes.
acne goes away completely.
And they found that it has this effect on anti-aging and
It
collagen
does.
stimulation.
It does. As a matter of fact, so a lot of the retinoids that we tend to use not only they have also chemoprotective factors. I mean, they
Yes.
are able to
Prevent
protect you from
skin
skin
cancer.
cancer.
Right.
Yeah.
Right.
So
Very true.
it's
Yes.
and we've utilized them for many reasons
Yeah.
because of this.
Yes. They became actually like restricted medications because women in their childbearing ages, they cannot take them, especially as oral, because of their they can cause congenital malformations in the
Exactly,
fetus. Yes.
exactly. And this, since we're talking about this, the way to educate patients is that it only requires a month off. Okay, because a lot of people think,
Yes.
oh, I have to take it for, like, I have to stop it 6 months before getting pregnant. No, no, no. It's you need to stop it just a month before getting pregnant, and you're fine.
And fine, that's a great information here.
Yes,
Yes.
because a lot of people are averse
Yeah,
to
they're
using them.
afraid
They're
to use it.
afraid because,
Yes.
oh, I can't. A doctor told me I have to not be pregnant for 6 months or for 12 months. No, no, no.
One
Just
month
one
should
month.
be enough.
Yeah.
Okay. Not to forget exfoliation
Yeah, of
or
course.
peels and
Yeah.
chemical peels and these things. Since we are on this topical products or topical applications,
Mm-hmm.
what do you tell us about peeling the skin?
So peels, I mean, peels have been around for a long
Yes.
period of time, and we're talking about, Cleopatra used to, the pharaoh used to be in. She used to put herself in a tub with sour milk, and sour milk contains a little bit of lactic acid, and then her handmaidens would come in and they would exfoliate her skin. So this was known all the way. We're talking about more than 3,000 years ago. Okay, so that's where the peels actually have come from. The way that I like to divide peels is that you have very superficial, medium, and deep peels. Let's talk about the deep peels so that we can get rid of them on that aspect. Deep peels are not, especially in our skin type, people in the Middle East who have, who are olive toned skin. Deep peels are not something that we're able to utilize because it has side effects, especially pigmentation or even hypopigmentation. Okay, so we don't tend to use that, even though they have fantastic results. As a matter of fact, the deep peels have even better results than some lasers, you believe it or not. They're really very great. So those are the deep peels. The ones that we are able to utilize here will be your very superficial all the way to your medium peels. The very superficial peels are the ones that you are able to use in your home. Okay, so you have certain products that contain a little bit of glycolic acid, a little bit of salicylic acid, or mandelic acid, based on what you have, whether it's pigmentation, acne, and so forth. You have your peels for those. Then you have your superficial and your medium peels you're able to do in clinic, and they're professional grade, and that's important because if you do them at home, you may get side effects such as burns and so forth, or scarring even. So that's the reason why they have to be done in clinic, because they have to be neutralized. Okay, you apply them for a certain period of time, and you see changes on the skin, and then you neutralize them immediately.
All right.
So those are where they are.
How effective are these?
They're very
in
effective.
rejuvenation.
They're
Effective?
Unfortunately, peels have a bad rap because they are cheap.
Underestimated.
They're
Yes,
cheap.
yes.
That's the reason
that's the
why.
reason.
Exactly. I mean, but if you look at, as like I said, I'm an old school traditional dermatologist. If you give me lasers or peels, I would always choose peels. Peels are, they've been, if you've got something that's been around for 3,000 years, and it was great for Cleopatra, trust me, it's going to be great for you too.
Exactly. I'm going to do it. And the last part of our podcast are the oral supplements, that directly affect skin health and improve it, and skin appearance also. So, retinoids?
So, I mean, this is an interesting part, because a lot of people, when it comes to retinoids are medications. So, I mean, you cannot give, for example, isotretinoin for a person for rejuvenation effect. I mean, it's off-label. Okay, so it's not something that's indicated for certain individuals, but some people do. Okay, they're dosed, for example, once a week or so forth.
After visiting the dermatologist.
After visiting
we are
the
not encouraging them to get it on
absolutely.
their own.
And it does wonders. It really their hair changes, the texture of the the hair changes, their pores become a little bit smaller.
Yes, yes.
A lot of people even say that their nose has become slightly smaller because the nose is very sebaceous,
Yes,
very oily.
yes,
So
very oily.
if you decrease the oil production there, it works. So retinoids will definitely work. But these are medications. When it comes to supplements, which are you're able to find, for example, on the outside, me personally, I don't find, for example, collagen supplements work very well. And the studies that have been published
Debatable.
are very debatable. They're very contradictory. And most of them that show that they work are actually been promoted by industry. So industry are the ones who sponsor those studies. So because the stomach really breaks down collagen and you don't see that effect there.
Yeah.
Things that will tend to work, for example, will include things that will contain antioxidants. If you're taking, you're drinking a good smoothie, something that has a lot of, vitamin C and so forth, it will work. It will
Berries,
definitely.
strawberries,
Berries,
these kind
strawberries,
of
a lot of the
fruits, yes.
antioxidants will
Yes.
definitely help you.
Yes.
Tomatoes, because
Yes.
they contain a little bit of
Yes.
lycopene, are fantastic for that. My supplement that tends to work for skincare, for any care that is, I believe, extremely important that anyone should be on is vitamin D. So vitamin D should be taken by each and every individual. I take one on a regular basis.
Yes,
Yeah,
very
so-
well said.
yeah.
Yeah. Anything else in this supplement part? We know there are a lot of supplements for longevity and anti-aging nowadays, which is a very sought after topic.
Absolutely.
And everyone is speaking about it. But we are focusing on the skin. So retinoids are medications. Probably they are okay for some people based on a prescription. And we have, on the other hand, vitamin D, and we have some maybe antioxidants,
Yeah.
whether from food or from other
I
supplements.
prefer taking them
That
from
can,
food.
That
yeah.
can work. Okay.
Yeah.
Collagen is debatable. Some
That's correct.
research support that
Some do.
that collagen can help skin appearance.
Some do.
But we are still, I think, in the early phases. We will wait and see.
Exactly.
Okay. Dr. Hassan Galadari, thank you very much for all these valuable insights. Really great information. You added a lot to what myself know, and I think all the people also had great awareness and insights about all these advancements in skin procedures and the way and supplements and all the ways that we can improve our skin health and appearance. I leave the final word to you.
Well, thank you for having me, Dr. Wafaa. I mean, I think you're doing a great job with this podcast, especially when it comes to educating individuals, and you've got a number of different specialties that you're showcasing, and I think that's very, very important. My take-home message, I guess, my final point is for everybody who's listening, is to really kind of do your research and at the same time don't follow trends. Unfortunately, everybody's now following, social media, whether it's on TikTok or Instagram. What is the latest trend? You need to kind of make sure you do your research. Personally, rather than following a trend, utilize, for example, your chatbots like a Chat GPT and so forth. They will help you. They've got really great information there. It's phenomenal. And then also supplement it with visiting a professional. Okay, a professional who knows the field, who's got the experience and the expertise, and who has also a track record on performing procedures safely and effectively.
Dr. Hassan Galadari, thank you very much.
Thank you.
Thank you.